Welcome to another episode of the Edmonds Moms Room podcast. Dr. Allison Felt here, and today I am so excited to bring on Suzie Driscoll. Did I say your name correctly?
You did.
Oh, I'm like, I should have practiced that.
Yeah.
Suzie owns Tiny and Mighty Therapy located here in downtown Edmonds. And I wanted to bring her on before I let her jump on and give her a little background about herself because, as you know, we have so many clients who are moms who are going through different challenges of having newborns to all things toddler. And it seems nowadays that everybody is diagnosed with a tongue tie and has some kind of feeding issue. So I would love to dive into some of this with you. And that's where I felt like Suzie would just be the best resource to come on here and talk to us about it because you come with a lens of developmental milestones. You come with a lens of the knowledge of, typical and atypical development. So that's why I wanted to have you on. I also love that you're a local business owner. And if you don't know, if you've ever sought out OT services for your child, it is a nightmare because no one has openings, right? And you used to be at Seattle Children's, and I think a lot of people travel from up north to go down there. So I just think it's what a beautiful offering you have for our community, and I'm super grateful you're here, and I'm glad I get to know you. So welcome to the podcast.
Thank you, Dr. Allison. I know it's lovely to be here. Thank you so much for having me. And I just love that we're neighbors here in downtown Edmonds as well. So yeah, I'm always, not the best at introducing myself, but I will try. So I am Susie. I'm the owner and founder of Tiny and Mighty Therapy here in Edmonds, Washington. And I'm a pediatric occupational therapist. So going back a little bit with my background, I became an OT in 2017. And my first job out of OT school was working with adults in acute care at Swedish First Hill. And while I never thought I would like be in that kind of setting, I just really, really loved it. I thrived in like that fast-paced setting. It gave me really great foundations for, like the medical, world. And when the opportunity opened up at Seattle Children's about a year and a half later, I jumped on it because my heart's always been with pediatrics. So I worked there for almost 5 years. And during that time, the pandemic happened. I became a first-time mom and all of that. It's a lot of changes. And my daughter actually went through the tongue tie journey as well. She had some latching issues right from the start, but I had no idea because it's different when you know, you are a clinician, but it's also different when you have your own baby, right? And I don't think I've ever held like a baby that was literally just born, even in my practice. So yeah, a lot of things were going on. So yeah, kind of going through that, I realized there's not a lot of support for, families, especially new first-time parents, while they're trying to navigate this feeding journey earlier on. In my practice at Seattle Children's, I saw kids from like 0 to actually like 21 years old, right? Depending on kind of their diagnoses. So it was like a big, broad range, which was wonderful for me to learn about, how like those developmental milestones can like look in different stages and ages, and how, important the foundation is from the get-go. Because very commonly, I would see kids who are like 8, 9, 10 years old who come to see me for the first time and they're like, oh my gosh, my kiddo has had these feeding challenges since they were like 1 or 2, but we never really had like support. Or, I would look in their mouth and like do assessment. And then it's like, has anyone told you there are some restrictions with, the tethered tissues, with the tongue and lips? And like, no, we had no idea. So I was like, what if we address this from the beginning, right? So that we can set up these families for success and save them years of, hardships and, struggles. So yeah, and then I decided to take the leap of faith. It was really scary to leave my stable job, right? But I figured, like luckily I feel like our professions are pretty in demand, just being in healthcare. So it's like if it doesn't work out, I can always go back or go work at school district too. That's like nice and flexible as a mom. So and over 2 years later, here I am opening my brick and mortar space and yeah, supporting my families and babies. So it's been a fun journey so far.
That's fascinating. Okay, I have to ask you, we can get to, some questions and we'll go through the list of everything we wanted to touch on, but I have to ask you this. So the kids that you were seeing that would show up in your office, they're 7, 8, 9, and you're looking in their mouths and you're like, and the parents are saying there was feeding issues in the beginning. And how are those, what is that, what's manifesting by that 7, 8, 9? I'm just curious.
Yeah. Oh man. Yeah, that's a great question. Every, child is a little different, but like, generally I would see, a lot of picky eating, right? The kids eat less than 15 foods. They mainly kind of go towards those like beigey, kind of easy to chew, like simple processed foods. Rarely, sometimes there would be some fruits, berries, right? Those are most kids' favorites. But very, very rarely there would be any sort of meat or vegetables. And I think that is, mainly because, when there are restrictions, you only have so much range of motion, right? And it's not quite safe to chew it up and swallow. So kids do well when they can. And when even at an early age, they're like, ooh, this doesn't feel safe for me to swallow because I can't quite chew it up. They're like, okay, no, I'm not gonna do this. And it's not that they were picky from the start. They just kind of learn about, this behavior. And that's kind of what I feel like sticks through the older childhood ages.
Thank you. I'm totally asking you this from a selfish vein because
Ah,
we kind of
I
deal with
love
this for my 7-year-old. So I'm being so selfish with this podcast right now, I guess. Um, and so if that's the case, and my 7-year-old has, oral restrictions, could then working through that with you or another occupational therapist, would that then help with the picky eating? You actually never hear, I mean, I am all over every picky eating
yes.
entity and I never really hear, oh, it's because of oral restrictions. I'm not even kidding you. Like, but I am in healthcare.
Yeah, I mean, like we all have our niche, right? And we're always learning.
Yeah.
Yeah, yeah, you're like the expert in pelvic health and yeah, and like I do feeding. Um, yeah, great question. So simple answer is yes, we can definitely support, kids at any age, right? But it may take different types of therapies or, support. And I'm happy to talk about that if you would like to hear.
No, I just wanted some hope. I guess that's all. I mean,
Yeah,
and
yeah.
really, like, isn't that what any mom just wants, right? Is just the hope that, and I haven't even considered OT. I was like, well, maybe we should do like before his next surgery, we should do like some speech. And,
Yeah.
you're just like going down the list. And
Yes.
at some point, you're really freaking burnt out by your child's health. And you're just like, they're going to be okay. Like, that's kind of the vein I've had to take with him. Like, he's going to be just fine. And it's like we're doing what we can, right? And
Exactly.
and so I think, yeah, this podcast is for me, apparently,
It's
and
for
all of
all
our
of us.
listeners, because I think it is like whether you're having a newborn baby that's, we'll dive into what that looks like. But like if you have a newborn that's struggling with feeding, um, or you have, a 7, 8, 9-year-old who struggles with feeding. And
Yeah.
when my kids were born, like my two older kids, I have a pandemic baby too, like you,
Mhm.
but my two older kids, like they didn't, I don't think anyone checked them for tongue ties. Like it just wasn't a thing. And even in my practice, like moms weren't really um getting, babies checked for tongue ties. They might like stop breastfeeding very early on because it's just not working and they have to like move on to like formula feeding and everything like that. And like that's their story. But I think it really didn't start until later on. And you can maybe speak to this, that like tongue ties became a thing. And maybe this is our segue into tongue ties. Is that an appropriate, should we talk about that now?
Sure, yeah, I would be happy to. Yeah. Yeah, I feel like it's definitely become more, it's brought up into more like light in the recent years. I think so too. Where, for example, when I started at Seattle Children's at 2018, right? Like I was, delving into kind of the feeding therapy world. Sorry, I feel like someone's at my door, but they're fine. Um, and just learning more and more. And at the time I was seeing like kind of older kiddos, right? Relatively kind of like toddlers and up. And it was more like I would say focused on kind of like a sensory motor perspective too, right? Feeding's just really complex. So like everything affects everything. There's like the medical issue, there's some GI issue, like sensory, psychological. So it's you just have to kind of see the whole child, right? Not just the mouth. So things can get missed. And I feel like, in the recent years, where breastfeeding has become more kind of like encouraged, I feel like, compared to like our parents' generations or, um, it's definitely, and like social media too, I feel like that had a huge part with it. Like there's just more like knowledge and more like connections where you're like, hey, like, have you heard about this? Hey, like it's a tongue tie, right? So I think that also has to do with, some of that. But I think it's always been there, but just become more of a like people are more aware of it.
Yeah, fascinating. So, from your perspective, are you working with babies then?
I
From
am, yeah.
how early on?
Oh my gosh. Usually they come to me, the earliest is kind of like 2, 4 weeks.
Okay.
And sometimes like 4 months or older. It kind of depends. I feel like what I do isn't quite as like known yet, right? I want to change that. So hopefully I'll see babies who are a little bit younger too, so that we can kind of get them started. But usually like the first line of defense, I would say, are the amazing lactation, professionals. And then they refer to me.
Okay. And
Yeah.
then this is fascinating. So, are you working with babies after they have like a tongue tie lasered or cut or whatever it's called? Or are you trying to prevent that?
Oh my gosh, I'm so glad you. So I think this is kind of like changing too. Like in the past, right? Like why there's so much controversy around this tongue tie too is because, in every field there are better providers and not so great providers, right? And I feel like the general practice has been, I'm not trying to blame anyone. This just has been like a general practice, right? We just keep learning and do better when we can. Um, like, babies come in with a problem and then the release provider is like, yep, you have a tie. And then boop, like either laser or scissors, and then send them on their merry way. Some provide post-op, stretch protocol. Some are just like, no, you don't need to do anything. And that's why there's like so many variables, right? Like, and so many different outcomes. Some do really well and some don't. And I think what's been changing, which is like really positive in the recent years too, is that, a lot of therapists, OTs, PTs, SLPs, who are kind of more in this like infant feeding therapy world, realize, hey, for example, like for ortho, like we get therapy before and after for optimal outcome, right? You're not going to just walk into like a surgeon's office and be like, hey, can you do my knee today? Get my knee replaced. And then you expect to start walking and running. No, like you got to do some like strengthening, with PT and then some like, training for ADLs, like how to use like a raised toilet seat or, reacher with OT and, et cetera. So you can't expect, to get good results when baby's tongue is made up. I mean, everyone's tongue is made up of like multiple muscle groups. And then you release that. And then baby's like, hey, like I had this motor pattern going for the last, several months. It actually starts developing in utero in second trimester. So it's
Oh,
been going on for a while. You can't just expect babies to be like, whoa, like I can use my tongue all of a sudden. No, we have to like train their tongue to form new pathways and new motor movements. Yeah. You're a PT, so you get it.
I get it, but I'm also like, when I was in this with my daughter who had a tongue tie release, and she was my third. I had breastfed my first two.
Mhm.
My third, if I'm completely honest, intuitively, I knew she was just fine. And she had three different sicknesses within her first 4 weeks of life. So, of course, she wasn't gaining normally. But when you're in the thick of it, you're just like, you kind of just go along with whatever any of the providers say. Because you're like, okay, like I need to just do this. You're in survival mode, right? And you're just taking whoever's authority is speaking to you at the time. And so, I went the tongue tie route, even though it did not feel right, to be honest with you. And she was eating just fine. But then to have the tongue tie release, and I know exactly what you're talking about. This, they have the motor pattern.
Mm-hmm.
And then all of a sudden she's like struggling to eat. And I was like, she was not struggling to eat in the past, you know? So it was just so, as a parent and like a mom, like you are just, it's soul crushing. And then you're like, did I do the right thing? Right. And I think if someone would have been like, oh, you could do these things to try to prevent the tie, you know, like she's so sure, maybe she has some ties, like we all have some degree, right? Like we have to be connected. Um,
Exactly.
and so, um, and so like, anyways, I guess what I'm getting at is like that didn't feel right for me. And if I would have listened to my intuition and been a little bit more connected at that time, could I have made a different decision? Who knows? But that was our path and our journey. And there's just so much to learn from that. And I'm accepting of it. But I think that like if you would have come in and been like, actually, like we could try to do some prehab, let's try to see what we can change without like inflicting this wound onto my baby. Not that I'm saying that I understand people need to do that. And I don't mean to say it so graphically. And there is no judgment attached to it. It's just that it is that painful to like, I know it's so common. So it's silly to like wrap this emotion around it. But in the same vein, like when you're a new parent, and like she was my third, so it's not like I'm like a new parent, but any baby you have, right? Like you were going to do anything you have to protect them.
Oh,
And so I feel like you would give me a ton of hope if I knew
yeah,
that I could have done this without going that route, or at least trying that
yeah,
route. So am I
exactly.
interpreting this correctly?
Yes, 100%. I think one of my strengths is that I kind of went through it with my own daughter too. So I totally feel like wholeheartedly like what you mean. Like even though it's like a minor procedure, it's still like your baby and you're going through it and those stretches, your head's like, yes, I need to do this to prevent reattachment, but your heart's just like, I really don't want to make my baby cry and go through it. Yeah, I totally like, yeah. So thank you for sharing your story too. And I think like, yeah, like the things that I can provide for families who are like either have gotten like mixed opinions from different providers or kind of like, people are like, oh no, just go through it. But you're kind of like, in my heart, it's like, I want to try some other things instead of going more of invasive route. I can provide, that functional assessment. Like you said, like everyone has, frenula, right? But it really matters if it's affecting function. And it also depends on the family's goals too, right? Feeding goals. So I can provide a functional assessment, whether that tie is truly affecting the function or not. Also, it's not just about the mouth, right? Like feeding is a whole body activity. So sometimes babies have right or left-sided, head turning preference that can affect feeding. Their body may have some additional tension, especially if they had kind of like a little bit more of a significant, medical history, especially during like the labor and delivery process. Um, and, potentially like positioning. And some things I hear most often is that there's like no time for tummy time. And again, I come with like a lens of like, I get it, like I've been there when feedings take like the whole wake window, right? There really is no time to do tummy time. And that just by itself, strengthening those anterior cervical muscles for feeding and swallowing can make a difference too. So I try to come up with gentle ways to encourage more tummy time, ways to make it fun, right? So we're just kind of like going from all angles, treating the whole baby. And sometimes that really makes a big difference without going through the surgical route.
That's fantastic.
Yeah.
Do you think that a lot of I just didn't even know it was an option. I
Yeah,
mean,
it wasn't.
it just isn't shared, you know?
No.
It really isn't. I knew it was an option because maybe my older two have some form of tongue tie, and I definitely think my second probably does. But, and that's my son who I was telling you about. But like overall, like my oldest, she's just fine, right? And like my son will be okay. Granted, we have to get through some challenges, but like yeah, so it's just but those are like the cases of like do nothing, you know, and but they did tummy time and they strengthened and they have, but they're also normal developing children, and I'm sure this changes when you have some like atypical development as well. Um, but yeah, I guess where I'm going with this is why don't people talk about not
I
revising,
know.
like not cutting it, like truly
Oh,
as an
yeah,
option?
I know. I wish I knew the answer. I think there are just so many different factors.
Yeah.
Yeah.
Well, I appreciate you sharing. And I think that will give serious hope to any like
Yeah.
new parent listening to this, hopefully, and like hopefully intervene at that level because it's such an early level, right? And like some parents are told at the hospital that their baby has a tongue tie and they need to get it clipped right then, or
Yeah.
come back in 2 days or, you
Uh,
know,
I think also kind of what I really value as a provider is like, giving the family like all the information, right? So that they can make the best informed decision for them and their baby and their family as a whole. I really don't try to push them one way or another. I give them all the information. Here's what I see. Here's how it's affecting the function, or your baby is doing really well, right? Like just so that they can make the decision that makes the best, that's the best for their family.
yeah. Okay. I appreciate that. So this is for any listener that's listening. This is where, well, you describe what it is. Do you want to describe torticollis, like what it would look like, what we would see?
Yeah, yeah. You can tell by the baby like only preferring to look to one direction or the other. And you would want to go to like a pediatric therapist, whether PT or OT, to truly like assess if there's any tightness. Sometimes it can be just one-sided, like one plane. Or it can be like there can be rotation and then turning, which is like a little tricky with all the muscles in the neck. So you definitely want to consult with a therapist to help because it's like a muscle imbalance, right? One side is stronger, one side is weaker, and yeah, you want to um address that so that way, what can happen is if you are always facing one side, it can not only impact feeding, right, when you're turned towards one, chest or breast or the other, or when they're sleeping like in one side, direction, that can form like a flat spot, which can impact, we call that plagiocephaly, or it can be brachycephaly if it's flat on the back. And yeah, it can impact, if it's severe, it can kind of cause some asymmetry in the face and ears as well. So yeah.
I appreciate you sharing. And did I put this in my message to you? So this is where like a lot of parents would then be like, okay, get a helmet.
Hmm.
And I know that there's indications. I've had friends that are peds therapists that are like, you use these indications, and if it's this bad of a flathead, then you get a helmet for however many months. I'm also have a naturopathic friend who doesn't do helmets and just does a lot of she's an osteopathic physician. So she does a lot of moving of the bones to cure the flathead.
Oh, wow.
And so I'm just curious on your thoughts. Do you have any thoughts on that?
Yeah, just from like a pediatric, OT perspective with
Yeah.
my training being, in the hospital setting with Seattle Children's, right? Um, Yeah, so what I like to use like more objective data as well, right? When I can, not everything can be objectively measured at this age, but luckily there is a tool called a craniometer. Um, and you can kind of assess whether there's that asymmetry or not. And usually I believe it's 8 millimeters or greater difference can indicate like more of like a moderate severe level, where at that point, you do want to consult with like the potentially like craniofacial team, or like a hanger clinic that does helmets. Um, and by like when I catch these babies early, let's say like 1 or 2 months, I say, okay, I'm gonna measure them and we're gonna work on these, strengthening activities and exercises. And then usually kind of by like 3.5 months, if it's either staying around the 8 millimeter mark or worsening, then I would say let's chat with your pediatrician. and then kind of get this ball rolling because I think traditionally it's been kind of like, oh, by 6 months, if your baby's head looks flat, let's get that ball rolling. But it's actually better to get that started earlier if it's not improving by 4 months is kind of like my mark because it always takes longer to get into these places anyways, right?
Totally. Yeah.
And earlier means like less time in the helmet if that is indicated. So yeah,
No, that's cool. So, but what you're saying is like if we could intervene and like do some of these stretches early on, there's probably a lot we can prevent as far as flatheads
100%.
go.
Yes.
That's fascinating. So let's dive a little deeper because as like, let's say for some of our new moms or someone who's maybe having a baby in the next couple months, and they're like, well, I want to know these stretches that you're doing.
Mhm.
I know it's going to be like a little harder to talk through because a lot of people will listen this on Spotify, but we do, this is live on YouTube. So,
Got it.
but if we do, like what would be those are there some like gold standard prevention stretches that you think that parents should be doing?
Yeah, yeah. So ideally, like I wouldn't give out these stretches as kind of like a general thing. I want to see the baby first,
That makes
right?
sense.
Yeah. But some of the things we could do if you do notice babies turning a certain way is I feel like myself included, we always kind of like don't think about which way we hold our babies. And then if you hold them this way and they're looking out this way, right? And then every few minutes, every single day, like adds up. So if you notice doing that, like, oh, okay, let me hold my baby this way so they'll also look this way. Same with the cribs. They might want to always face towards you if they're in the same room, changing tables, just all these little things throughout the day can add up. So that's one thing I always talk about. And then you can try to encourage them to do more tummy time or while they're in on their backs in supine, you can kind of like, show them different toys so that they can track and try to move their necks too, right? Like active movements. So those are kind of like the basic things. And then based on what I see, if I see the baby in person, I can give them more specific exercises and stretches.
Oh, that's fascinating. So, and by the way, side note, because
Uh,
I am a pelvic floor physical therapist, switching your baby on either side of your body is so important for your pelvis and for how
mhm,
you weight bear symmetrically through your hips.
mhm.
Because if you're just shifting onto one hip while you're holding one side, that's going to create a lot of like more like right-sided low back pain or left-sided low back pain. So you have to, that's where it's like that's really beneficial for the mom
That's
and the parent
see,
too. Yeah,
I didn't even think about that aspect. So I'm like, yeah, that's amazing. Oh my gosh. See, like everything's kind of related. That's
it,
so amazing.
it is. I love that. Um, so when do parents, well, no, let me back up. I want to know, let's say a parent's coming to you either for a feeding issue or they've noticed that there is some asymmetry in their neck or how they're holding their head. What's a standard? Are they seeing you twice a week, 3 times a week? Like, what does that look like?
That's a great question. So the short answer, as you know, is it depends.
Yeah.
But like a generic, like general, most common answers, I like to see babies once a week.
Okay.
If I am going to see them for ongoing, like short bursts of therapy, usually babies make really quick progress. So it's like once a week for a few visits. Usually they're good to go. Some families choose to hang out with me a little bit longer, right, throughout all the milestones, which I love. Yeah, so it depends. Usually not more than once a week, unless, I feel like it's rare, but if I feel like we can make quicker progress in like a short amount of time, like an intensive, but very rare.
Yeah. Oh,
Yeah.
I love that. Okay, so this is the entrepreneur in me slash
Yeah.
mom. Like, if
Yeah.
you could have signed me up for a program that was like, I'm going to have my baby checked at 2 weeks, at
Wow.
4 weeks, at,
Mm.
at 2 months, at
Mhm.
4 months. Because, like, you go to the doctor and they just like, the pediatrician is looking for just
Yeah.
like, typical milestones, but not like quality of movement. So like, how is my baby doing this? How could I optimize their function? Like I said, I fully believe everyone's going to be just okay, at the end of the day. But like, if you could have caught, certain
Mhm.
preferences in their bodies or different patterns,
Yeah.
at the 2 week mark, like thank goodness my kid didn't have to have a helmet, but if you could have signed me up for this program, I'm signing up for that all day long, right?
Oh, yeah.
And So maybe there's something to that. Maybe you already do this and you just don't know you do it. Because when you said I have families that stay with me through all the milestones, I was like, where were you when my kids were this age? And like, I just need you to sign me up for the package that I can be like checking my
Mm,
boxes,
yeah.
and making sure like my kiddos like hitting these milestones. Because I mean, as a physical therapist, when you have the pediatrician, you're like,
Yeah.
I know that they're hitting like the standard milestones, but like
Yes.
I want someone's trained eye to be like, oh no, they are eating their peas correctly. Or like, just silly things, right? Like,
Yes.
wait, why is she doing that with her eye? Like,
Yeah.
oh, let's have her just like start training the muscle to go this way.
Mhm,
These aren't
mhm.
things like
Yeah.
maybe as a new parent, you don't look at it with like that trained of an eye. And I'm for sure not a pediatric therapist whatsoever. But I would have liked to have like that developmental checklist, just be more thorough, right? Especially if you're telling me this could have prevented a flat head. Every single one of my friends whose kids have had to have a helmet, they would have signed up for this every single day, right? And so, because like no one likes sticking their kid in a helmet.
Right.
Um,
Yeah.
so I just maybe that's the new thing.
Yeah. Oh my gosh, Allison, this is why I love chatting with you because you're like a mom, you're like an entrepreneur, you're a PT. So like yeah, you have so many great ideas. And I'm just like, yeah, I love that idea. Like when I get some time, maybe that is something I may develop as like a package. But at this time, I'm very like fluid to meet like where the families are. But yeah, for example, some families are like that, right? Like I see them early on when they're weeks old. And then the next milestone check-in usually is like kind of 3 to 4 months, I found, when families reach out, because that's when the sucking reflex that we're born with starts to kind of fade away. So then potential problems may arise, right? And then, yeah, they can reach back out to me if that's the case. And then the next milestone might be like around 5 to 6 months when they're ready to start eating solids. And then kind of again, like 8 or 9 months when like, is this going well? Are we providing all the textures and flavors? So I like that idea. I might somehow kind of,
You're never going to get time. You have to just create it,
I
right? So
know.
like no
So,
pressure, no
so
pressure.
wise, right?
No pressure. So no, that's cool. Yeah. So and when I originally reached out, I was like, I want you to go through and touch on all the
Mm,
milestones, but I don't know if that's necessarily the move you want to talk about next, or if there's just certain things that you want to say, hey, like speaking to the moms at our clinic. I mean, we have people from, the time they're trying to conceive to when they conceive to we always try to see them prior to 2 weeks after they deliver. So it's a virtual check-in essentially. And that's where we can make sure like, okay, is feeding going okay? Is your body okay? Where are we at? And then that allows us to like fill in resources where it's needed.
yeah.
And so we do that at the 2 week mark, but where like and then we continue on pretty
Mm,
much essentially for like the next 18 months in some capacity of their journey, just because our hormones fluctuate so much, the body changes so much. And so that's kind of the journey. And by that time, a lot of people are, pregnant again.
yeah.
But as far as what are some things that we should be looking out for? What are some important check marks? You can go by milestones, but I'm just going to leave this out to you what we should be looking for or where, at what point, yeah, at what point are we seeking out this help?
Yeah, that's such a great question. It's so open-ended, so I can like go on, right?
Yeah.
Yeah, I think it'd be very similar to kind of what I, just shared a little bit about, early, like in the next, or sorry, in the first kind of 2 weeks or so, if let's say like, feedings aren't going well, baby has not been able to get back up to their birth weight, right? And just, mom's intuition, as you said, right? Like something is a little bit off. Like I feel like I could use a little extra support with this. That might be a really good time to just check in, right? Especially if they're already working with lactation consultant for supply and kind of like, positioning, latching, but there's still something about like the oral motor skill, right? Or if they notice that they earlier on like already have developed a preference for turning to one side or the other. So yeah, kind of like like the first month, I think I would say would be a good time to check in. And then yeah, the next time would be again like kind of the 3 to 4 month kind of mark. when you notice that the feedings all of a sudden seem to be getting sloppier, like the baby's tongue isn't quite making that nice cup position to like suck the milk, but it's kind of going like that's what I hear happen. Like all of a sudden, like baby is just like playing with it or like pushing the nipple out, and taking like 45 minutes to an hour plus sometimes to finish the bottle or feeds. So that's something I hear very commonly at that age. And again, kind of like 5 to 6 months when either families are like, ooh, like I'm so nervous about this. I would love to like have some, hand in hand support to go through the starting solids journey. And then yeah, kind of on and on.
Oh, I love that.
Yeah, yeah. I love what you provide too. I wish I had you like 2 weeks postpartum. Like, oh my God, like, just like, is
It's
everything
so
going
fun.
okay? Yeah.
I mean, it's equally selfish because we get to like be part of the journey. It's so fun just being, supporting people at that point, hearing how their birth journey went, how they're functioning. I think I just love it so much because when you can provide at that level of support, the journey is just easier. And that's what I hope that's what it does. But this isn't about me. I want more um, from you. When you were just talking about like the sloppy tongue, that was a great impression. Everyone should watch this on YouTube because of your sloppy tongue impression. Um,
I it a lot. And parents do it too. I was like, yep, that's it.
I love it.
Yeah.
But that got me thinking about my new niece who's here, but she has so much reflux and she's just constantly spitting up. Her brother did it too. And so is that something, and you could say no and move on, but is reflux also connected, like a part of the situation? You brought up gastric function, but now I'm curious. What is your thoughts on this or how is it related?
Oh my gosh, yes, it's all really, I'm so
Yeah.
glad you mentioned. Actually just attended like a reflux webinar last week, but yeah, so I will show you with my little mouth model because I'm a visual learner and I love your reaction. People are either fascinated or terrified when I bust this out. So ideally, right, we want our palate to be nice and broad and U-shaped so that our tongue can rest up there. And then that will help promote nasal breathing because our mouth will be nice and sealed and it'll form like that nice arch for the teeth formation and everything and, swallowing. However, when there are some tethered tissues here, tongue tie, and it can't quite reach up that high to the palate can form kind of higher and narrower. And sometimes we call that kind of like a bubble palate, right? Sorry, my background blurry is affecting the mouth too. I'll have it in front of me. Um, so that way, when kind of going back to the ideal position is your tongue and the palate and the mouth and lips should all work together so that, the nipple is here, whether it's breast or bottle. The tongue will suction really tightly up against the palate and then go through like that nice wave-like and extension and retraction motion to get the milk out effectively. And then the whole mouth will have a very nice negative pressure to have that nice seal. However, kind of again, going to that atypical, like the tight tethered tongue with the high arch, the nipple's right here and the tongue's kind of like, I want to try to get it up there. But then there's that extra gap. I'm not sure if you can kind of see because of the palate being narrow and high. And then the tongue's kind of like, okay, I'm gonna try to get up there. But then when it's like, oh, I just can't hold on any longer, it pops off, making that clicking sound. And that's one of the common signs too. And like I hear my baby clicking a lot, right? And then the jaw is chomping because it's trying to help the tongue to get up there too. So just all of that at play, and then that extra gap causes extra air to go in, which can contribute to reflux and hiccups and yeah. So that was a long-winded answer.
No, that was so good. You have my brain really going.
Yeah.
Um, of course, this is like so we're doing this because I want to get the word out there for new moms and support new moms on that level. But I just can't. this whole thing is really just about me. It's just my son that I'm like, I need to get I have to get him an appointment with you so you can at least look at his mouth. And yeah, it's just I really can see. I don't rem we didn't have issues with his like breastfeeding journey, and I don't remember having clicking, but
Mhm.
there's definitely issues now with probably his palate and his tongue
Mhm.
position. He's
Mhm.
clinically deaf right now, and it improves. It's conductive hearing loss. It can improves when we have a new set of tubes.
Mhm.
And he's had multiple adenoid
Oh,
resections. And
yes.
so I'm just so fascinated. And I'm, of course, then now blowing this up to the whole world. And this is his story to tell. So I hate to like give his whole medical history away, but it is, I think, beneficial to share this because other parents can relate to this, right? And so many parents go through this journey. So I think this is my pitch to you. Truly, like if I could have had him at least evaluated again, I thought he was completely normal. He was gaining a ton of weight. We breastfed, whatever,
Mhm.
but even if we just like, if I could have had his tongue position evaluated,
Mhm.
at 6 months, 1 year, at 2 years, it's like, would that have shifted this
Mhm.
whole journey? I don't know. We'll never know. But I think that's where it's like, if that was standard of care, like if you could change, good luck. This is your mission to humanity. I guess I just gave you a whole new mission. Like if you could just
Yeah.
change, right, what standard of care is, then it's like, wow, how many parents could we save? And like I'm talking like audiology, ENT
Mhm.
has been our journey, but like I so much of my I it's been on my mind to get him other services because I'm like, I think something else is happening. And his body just is honestly, he's a magical healer. My husband is very similar. And
Yeah.
he just pushes the tubes out. So it's like we have these permanent tubes that are supposed to last for 18 months to 2 years.
Yeah.
No,
Yeah.
3 months,
Like,
6 months, done. And it's like, okay, like because his body is just magically really good at healing. And a lot of our bodies are. And so
Mhm.
I do think that's where it's like when you take a more conservative approach, doing work with you might take a little longer than just going to the doctor to cut the tie, right? But in the long run, it's like, what benefits is that having versus not addressing the root cause, right? Like, or changing the root pattern.
Yeah.
I don't even know if this is making sense, and hopefully, like, the
Yeah.
listeners can draw something from that. But it's like, I really do wonder how much is related to what we go through later on.
Yeah, it's all impacting. I'm so glad you brought up the adenoids too, because that's something that we see often. I mentioned a little bit of that kind of like mouth breathing, right? And then
Right.
nasal breathing. So another thing you can kind of be on the lookout for is if your baby tends to always sleep with their mouth open, with their tongue kind of resting like this. So ideally, they should be sleeping with their mouth closed, breathing through their nose. And then when you gently pull down the jaw or chin, their tongue should be upwards like this. But, again, kind of everything being related to everything, the high palate, right, impacts the nasal pathway because it's the different sides of the same coin, where the floor of the mouth is a palate, but that's also ceiling of the mouth is a palate, but it's also the floor of the nasal cavity. So then if this is high and narrow, then the nasal cavity is high and narrow up here too. So then they're like, I can't quite get enough airflow through my nose, so I'm gonna open up and sleep. And then the adenoids and I'm losing my words already today. What's
Tonsils.
the other? Thank you. Can get kind of swollen and irritated.
Oh, that's great. Okay, so the check is, so in case people are not going to rewind this, but they want to just get it again, the check is to check your baby, just open their mouth while
Mhm.
they're sleeping and see where their tongue is resting.
Yeah,
And
yeah,
ideally that's on the top of their mouth.
correct.
And
Yeah.
is that at any age through childhood? Like that is
Yes.
standard position?
Yes. Yeah. Yeah.
Perfect. Thank you.
Yeah, of course. Yeah. Thank you.
Well, this has been super great and very, very informative. I think
Mhm.
every parent, even if you don't have a newborn, you could relate to this. So
Mhm.
yeah, cool. Is there anything else you want to leave us with before we sign off?
Yeah, I think like my, last kind of like thing to leave you guys with is you know your baby and child the best, right? You're their parent and you're the expert on your own child and kiddo. But if you ever have questions, it doesn't hurt to, seek out some support and provide you with some information that you can kind of take and then see what makes sense to you and then digest it and then make the best informed decision that's right for you and your family and your kiddo. And that could, hopefully you'll have some good providers who will have a very collaborative team approach, right? Like I can't do everything, right? Like I always work closely with other, body workers like chiropractors, CST, lactation professionals. For older kids, like myofunctional therapy is really effective as well. Of course, pediatricians, PTs, like I said, like just everyone on the team. So hopefully, yeah, that would be the ideal world.
I love that.
Yeah.
Oh, so many ideas. Can
Yeah.
you tell us where we can find you?
Yeah. So I am located now in downtown Edmonds, actually really close to your office, which I love. I'm sure we can get coffee more often
Yeah,
and go on walks. And I can be best reached at my Instagram, which is tiny and mighty underscore OT, or my website at www.tinyandmightytherapy.com.
awesome.
Yeah.
Well, we'll put that in the show notes for anyone that is looking. Thank you so much for doing for this. It was super informative for me, and I appreciate you sharing all your knowledge and helping us moms soothe our souls a little bit so we don't have to, so we can have the right support and maybe make a little bit more informed decisions. So I appreciate you sharing all this information. Thank you so much.
Thank you so much for having me. It was a pleasure.